What if I told you that NCLEX isn't testing what you know? It's testing how you think. Most nursing students fail because they study facts, but NCLEX wants critical thinking. Today, I'm breaking down the exact thought process that gets you the passing score. This is the video your nursing school professors won't teach you. If you're serious about passing NCLEX on your first try, hit that subscribe button right now and drop a comment with your test date. Let's turn you into an NCLEX thinking machine. Welcome to Nursing Simplified. I'm here to decode NCLEX so you can pass with confidence. Here's the truth. NCLEX is not a memorization test. You can know every disease, every medication, every lab value, and still fail. Why? Because NCLEX is a critical thinking exam designed to see if you can think like a safe, competent nurse. See, in the next 20 minutes, I'm going to teach you the 5 priority frameworks NCLEX uses in every question. The nursing process pattern hidden in answer choices, how to eliminate wrong answers in 10 seconds, real NCLEX-style questions broken down step by step, and the mindset shift that changes everything. Before we dive in, do me a favor, smash that like button if you want more NCLEX strategies like this. It helps this video reach more nursing students who need it. Ready? Let's learn how to think like NCLEX. First, let's define what NCLEX thinking actually means. NCLEX thinking is priority-based decision-making. It's not about what's correct. It's about what's most correct. It's not about what you can do. It's about what you should do first. Think about it like this. You walk into a patient's room. The IV is beeping. The patient says they have chest pain, there's water spilled on the floor, and a family member is asking you questions. A new nurse panics. An NCLEX thinking nurse prioritizes. The NCLEX mindset asks 3 questions. What threatens life first? What can I do as a nurse before calling someone else? What action prevents harm? Let me give you an example. A nurse is caring for 4 patients. Which patient should the nurse see first? Option A, a patient with diabetes asking for their insulin. Option B, a patient with chest pain radiating to the jaw. Option C, a patient requesting pain medication. Option D, a patient asking about discharge instructions. Pause. What did you pick? If you said B, you're thinking like NCLEX. Why? Because chest pain radiating to the jaw signals a possible MI, a life-threatening emergency. That's priority number 1. The diabetic patient needs insulin, but they're stable enough to ask. The patient wanting pain meds is uncomfortable, but not dying. Discharge instructions can absolutely wait. NCLEX thinking means life over comfort, urgent over routine. If this is making sense, drop a comment below saying priority so I know you're following along. Now let's talk about the 5 frameworks NCLEX uses to test your thinking. Master these, and you'll eliminate wrong answers like a pro. Framework 1 is ABC, airway, breathing, circulation. This is your number 1 priority. Always. If a patient can't breathe, nothing else matters. Here's an example. Which finding requires immediate intervention? Option A, patient with diarrhea for 2 days. Option B, patient with oxygen saturation of 88%. Option C, patient with blood pressure 150/90. Option D, patient complaining of nausea. The answer is B. Oxygen sat of 88% is a breathing problem. That's your B in ABC. Address it first. Framework 2 is Maslow's hierarchy. Physiological needs come before safety. Safety comes before love and belonging. You can't teach a patient if they're in pain. You can't educate if they can't breathe. Here's an example. A patient is reporting 9 out of 10 pain and wants to learn about their new medication. What should the nurse do first? Teach them about the medication? No. Manage the pain? Yes. Pain is physiological. Education is higher level. Maslow wins. Framework 3 is safety. NCLEX is obsessed with safety, fall risk, infection control, medication errors, suicide precautions. These always take priority. Here's an example. A nurse finds a patient trying to climb out of bed. What should the nurse do first? Option A, document the behavior. Option B, call the family. Option C, stay with the patient and ensure safety. Option D, restrain the patient. The answer is C. Safety first. Never leave a fall risk patient alone. Framework 4 is least invasive to most invasive. NCLEX loves the answer that's therapeutic, non-invasive, and patient-centered. Always try the least invasive intervention first, unless it's an emergency. Here's an example. A patient is anxious before surgery. What should the nurse do first? Option A, administer prescribed anti-anxiety medication. Option B, use therapeutic communication and provide reassurance. Option C, call the provider. Option D, delay the surgery. The answer is B. Communication is least invasive. Try it first. Framework 5 is the nursing process, also known as ADPIE. Assess, diagnose, plan, implement, evaluate. This is the golden framework. Assessment always comes first unless the patient is in immediate danger. Here's an example. A patient reports feeling dizzy. What should the nurse do first? Option A, notify the provider. Option B, assess vital signs. Option C, document the complaint. Option D, assist the patient to bed. The answer is B, assess first. You need data before you act. If you're loving this breakdown, hit that share button and send this to your study group. Let's get everyone passing together. Let's go deeper into the nursing process because NCLEX hides it in almost every question. Remember, assess before you act, unless the patient is dying. Here's how to spot it. A patient who had surgery 2 hours ago reports severe incisional pain. What should the nurse do first? Option A, administer prescribed pain medication. Option B, assess the surgical site and vital signs. Option C, notify the surgeon. Option D, reposition the patient. What's your answer? If you said B, you're correct. Why? Because we need to assess first. Severe pain 2 hours post-op could mean bleeding, infection, or complications, not just normal post-op pain. Assess before you medicate. But here's the twist. A patient is choking and unable to speak. What should the nurse do first? Option A, assess lung sounds. Option B, perform the Heimlich maneuver. Option C, call for help. Option D, check oxygen saturation. The answer is B. The patient is actively dying. You don't assess, you act. Heimlich now, assess later. The rule is this. Assess first, unless it's a life-threatening emergency like airway obstruction, cardiac arrest, or severe hemorrhage. Let me give you 3 more quick examples. Example 1. Patient with chest pain. NCLEX wants you to assess. Check vitals, pain characteristics, ECG. Not give nitroglycerin without assessment. Example 2. Patient reports shortness of breath. NCLEX wants you to assess lung sounds, O2 sat, respiratory rate. Not call the doctor without data. Example 3. Patient's IV site is red and swollen. NCLEX wants you to assess. Check for infiltration, phlebitis. Not document without inspection. See the pattern? Data first, action second. Drop a like if the nursing process is finally making sense. NCLEX loves therapeutic communication. But here's what nursing students get wrong. They think NCLEX wants them to be nice. Wrong. NCLEX wants you to be therapeutic. Therapeutic communication explores feelings, encourages expression, is open-ended, and is patient-focused. Non-therapeutic communication gives advice, minimizes feelings, is closed-ended, and is nurse-focused. Let me show you. A patient says, "I don't think I can handle chemotherapy." How should the nurse respond? Option A. Don't worry, you'll be fine. Option B. Tell me more about your concerns. Option C. Chemotherapy is very effective. Option D. You should talk to your doctor. The answer is B. It's open-ended, explores feelings, and keeps the focus on the patient. Let's break down why the others are wrong. Option A is false reassurance, which is non-therapeutic. Option C is giving information without addressing feelings, which is non-therapeutic. Option D is passing the buck, which is also non-therapeutic. Here are the NCLEX Therapeutic Communication winners. Tell me more. How does that make you feel? What concerns you most? I'm here to listen. Here are the NCLEX losers. Never pick these. Don't worry. Everything will be okay. You should. And why did you? Because why questions are confrontational. Let's do one more. A patient says, I'm so scared about this surgery. The nurse should respond with which option? Option A, there's nothing to be scared of. Option B, the surgeon is very skilled. Option C, what specifically worries you about the surgery? Option D, I had the same surgery and I was fine. The answer is C, open-ended, explores feelings, therapeutic. If you want more communication strategies, comment therapeutic below, and I'll make a full video on it. And don't forget to subscribe if you haven't yet. We're just getting started. NCLEX loves to test delegation. Here's the secret. Know what each team member can and cannot do. RN scope includes assessment, teaching, evaluation, unstable patients, IV medications, and complex care. LPN or LVN scope includes data collection but not initial assessment, reinforcing teaching but not initial teaching, stable patients, basic medications like oral, IM, and subcutaneous, and wound care. UAP or CNA scope includes ADLs like bathing, feeding, and toileting, vital signs on stable patients, ambulation, and basic hygiene. The NCLEX rule is this. You cannot delegate assessment, teaching, evaluation, or unstable patients. Let's practice. The RN is caring for 4 patients. Which task can be delegated to the UAP? Option A, feeding a stable patient with dysphagia. Option B, teaching a diabetic patient about insulin. Option C, assessing a post-op patient's pain level. Option D, ambulating a stable patient in the hallway. The answer is D. Ambulation of a stable patient is within UAP scope. Why not A? Dysphagia is a swallowing problem, aspiration risk. That requires RN assessment and monitoring. One more. Which task can the RN delegate to the LPN? Option A, administering IV, push morphine. Option B, completing the initial nursing admission assessment. Option C, administering oral antibiotics to a stable patient. Option D, developing the nursing care plan. The answer is C. Oral meds to a stable patient equals LPN scope. Why not A? IV push medications require RN judgment. LPNs can do IV in some states, but not push meds in most. Quick delegation rules. When in doubt, keep it with the RN. Never delegate unstable patients. Never delegate assessment, teaching, or evaluation. Match the skill to the scope. Share this video with your classmates. Everyone struggles with delegation. Let's talk about the traps NCLEX sets and how to avoid them. Trap 1 is the all of the above feeling. You read a question and think, all of these could be right. That's intentional. NCLEX wants the most right answer. Use your priority frameworks. Trap 2 is real world versus NCLEX world. In real life, you might chart first or call the doctor immediately. In NCLEX world, you assess first and do what you can do as a nurse. Don't bring your clinical experience into NCLEX. Follow NCLEX rules. Trap 3 is reading too much into questions. NCLEX gives you what you need. Don't add information. If it says stable patient, they're stable. If it says reports chest pain, believe it. Don't overthink. Trap 4 is choosing the nice answer. NCLEX doesn't want nice. It wants safe and therapeutic. The answer that sounds warm and fuzzy might not be the clinical priority. Trap 5 is ignoring the question stem. Is it asking for first action, priority, what to include in teaching? Read carefully. The question stem tells you what framework to use. Let's do a trap question. A nurse is teaching a patient about warfarin. Which statement by the patient indicates understanding? Option A, I will take aspirin for headaches. Option B, I will eat more green leafy vegetables. Option C, I will report any unusual bleeding. Option D, I will stop taking the medication if I feel fine. The answer is C. This is a teaching question. Look for understanding. Reporting unusual bleeding shows the patient knows the risk. Why are the others wrong? Option A is wrong because aspirin increases bleeding risk. Option B is wrong because green leafy vegetables have vitamin K, which decreases warfarin effectiveness. Option D is wrong because you should never stop anticoagulants without provider guidance. Comment below if you've fallen for these traps before. You're not alone. So how do you actually develop NCLEX thinking? Here's my 5-step practice method. Step 1. Read the question twice. First read, what is it asking? Second read, what's the priority framework? Step 2. Predict the answer before looking. Based on the frameworks, what should the answer be? Then, look at the choices. Step 3. Eliminate using frameworks. Cross out absolutes, non-therapeutic responses, and anything outside nursing scope. Step 4. Choose the most NCLEX answer. Pick the one that's safest, most therapeutic, and most patient-centered. Step 5. Review your rationale. Don't just check if you're right. Understand why. Read every rationale, even for questions you got correct. Practice resources I recommend include UWorld for the best rationales, NCLEX Mastery for great volume, Saunders Q and A for comprehensive coverage, and Mark Klimek lectures for priority frameworks. For a study schedule, during weeks 1 through 4, do 50 questions per day and focus on learning rationales. During weeks 5 and 6, do 75 questions per day and track weak areas. During week 7, do 100 questions per day and simulate test conditions. During week 8, review week content, do light practice, and rest before the exam. If you found this helpful, please like this video and share it with your study group. Let's recap how to think like NCLEX. Priority over preference, ABC, Maslow, safety. Assess first unless the patient is dying. Therapeutic communication opens dialogue. Delegate based on scope. Keep assessment with the RN. Avoid NCLEX traps. Read carefully, don't overthink. Practice with purpose. Rationales matter more than scores. You're not just memorizing facts anymore. You're training your brain to think like a safe, competent nurse. That's what NCLEX wants to see. Here's what I need from you. Like this video if it helped you. Comment your test date and one thing you learned. Share this with your nursing classmates. Subscribe to Nursing Simplified for more NCLEX strategies every week. You've got this. Future nurse, I believe in you. Now go practice, trust the process, and pass that exam. See you in the next video.